Welcome to the medication room in High Fidelity. We're just going to go over a quick room orientation so that you kind of know where things are. In this room, you're going to find a couple different things. The first thing that you're going to find is your crash cart. It has a stool with it, the suction machine, defibrillator with it. The most important thing with this is make sure that it is unplugged before you pull it out of the room. The next thing you're going to have is you're going to have lots of cabinets and drawers. The cabinets have locks on them. That means that they're not to be opened by students. And then the drawers are going to be labeled. However, the majority of the stuff that you're going to need is going to be on the countertop. So check the countertop first before you go into the drawers, because a lot of your more common items are going to be up here. Things that you will not find up on the top of the countertop are your needles. Your syringes. Some of your needles are up here. So your various size syringes are going to still be in these labeled drawers. The cabinets are just for storage, so you'll leave those alone. If you can see in the bins, we have some of your more common medical equipment, those types of things. So you will not find those here in the Omnicell, which is our storage and medication dispensing cabinet. So in the cabinet, you're going to find on the storage side some of your larger items like Foley catheters, or maybe some different trays like trach care kit, those types of things that would be chargeable to the patient. Otherwise, you'll want to check in your room and on the countertop before you start looking in the Omnicell. The other thing you have is you have your medication dispensing cabinet. So this is where all of your prescription medicines will be kept. This does not include your plain basic IV fluids. Those will be set out on the counter for your simulation. So when you have a simulation, you will find right here in this area, you'll find a sign that has your sign in and your passcode, as well as a witness. So if you were to have to do a waste or an insulin dose or something like that, you'll have a witness. So you will type those in, you'll press enter, and then you will be taken to your screen of getting your patient medication. So here we have medication retrieval and we have supply retrieval. So you can do both of those under one login, or you can do an either or. So just if you forget how to get into the Omnicell, which there's another instructional video on that, you always have the instructions to refer back to. So you would sign on, go to your patient, and then go ahead and take out your meds. The other thing that we do have is we have your a computer here. This is for the Omnicell, so this is not for reference for your case. And then you have your injection pads. So on our mannequins, if you go to do an injection like an IM or a sub-Q, you're going to take these with you, get your medication, to go back to the room, and then place it where you're going to give the injection and actually give the injection in the pad. You have some pencils, calculators, a sharps box, pill crusher, pill splitters, some reference manuals. If you have hospital policies or consents, those are going to be in here on the countertop. So if there's things that are not in the room and they're not on the countertop and you can't find them in the Omnicell, you'll want to just ask for assistance either in the room or call the pharmacy on the phone and someone would help you. And that is orientation to the med room.